Okay, hello guys. In this video we're going to show you how to perform an EKG, an electrocardiogram. And some of you guys have already had one of these done before, but many people have not had them done before and they don't understand that, what it is. An electrocardiogram is basically a machine that's going to record the heart's electrical activity. And so we're essentially taking pictures of the heart's electrical activity. The patient won't feel anything, it doesn't hurt, and it's fairly easy on the patient. Before you get started, make sure to, a couple of questions you need to ask the patient. First of all, you need to make sure you have the right patient, so identify your patient. You don't want to run an EKG on the wrong person. Secondly, we want you to ask the patient to ask you if to let you know if they're able to lie flat. This procedure is performed while the patient is lying flat on the table. And for some people that might be difficult, especially if they have breathing problems or if they have back problems. So always ask your patient if they're able to lie flat on their back. Also, ask your patient if they have lotion on. If they put lotion on, then that can make it difficult for the electrodes that we're going to be placing on their body to stick, as well as body oil, if the patient has body oil. So just some things to check before you begin. Alright, so we're going to go ahead and begin the procedure, and I have my grandson here that I'm going to actually begin. Now, in order to begin, you're going to need, of course, an EKG machine, some electrodes. You're going to need some electrodes, and I like to have cotton and alcohol ready, and that's about it. After your patient is lying flat on the bed, you're going to need to be able to access the inside of the leg, so you'll need to pull up their pant leg if they're wearing pants. The inside of the leg, also the inside of the arm. So we're just going to go ahead and pull the sleeve up. Now, if it's a female patient with stockings on, those are going to have to come off because stockings, really make it difficult to put if they have full-length stockings, those are going to have to come off. If they just have knee-high stockings, those can be pulled down. If their pants are so tight that you can't get to the inside of their leg, they're going to need to take those off as well. For the female patients, just unhooking their bra at the back is really all you need them to do. If they have several layers of clothing on, then you might have to have some of those layers taken off as well. Okay, so I'm going to go ahead and begin placing the electrodes on. Okay. Okay, so I'm going to take this first electrode. You'll see that there are actually 10 electrodes on this little plastic electrode holder. And I'm going to take the very first electrode. And if you look really closely, there's one side here that is very smooth, and the back side actually has a gel. That's a conductive gel. That's going to actually make the electrode stick to the patient's leg. You'll also see that there's a little tab here. There's the backside tab, and then there's the inside of the tab. On the legs, we want those inside tabs to be placed on the inside of the leg, not over the muscle, not over the calves, and not over the bony part, the shin. Okay? And we want the tab facing upward. Okay? So we're going to take another electrode and place that also on the other leg, equal distances down. So you want them to be equal distances, again, with the tab facing up. Next, we're going to place some electrodes on the arm. We're going to place it on the inside of the arm, just above the wrist, with the tabs now facing down. Okay, so we'll put another one on this arm, again with the tab facing down. Okay, the next thing we're going to do is we're going to be placing the electrodes on the chest. But before I do that, I want to kind of go over to the skeleton to talk about some landmarking for this. For the chest leads, the first thing you're going to do is I want you to identify the clavicle. Look for the clavicle, that's the collarbone, and we're looking for the right clavicle, the one on the right side. Sometimes you can actually see it. But we're going to trace into the inside section of the clavicle. Down below the clavicle is the very first intercostal space. Intercostal spaces are spaces that are between two ribs, and so you'll see here that we have the first intercostal space. If you jog down over the next bone, you're in the second intercostal space. And our first electrode is actually going to go in not in the first, second, or third, but in the fourth intercostal space on the right side of this chest bone known as the sternum. Okay, so locate the clavicle, go down 4 intercostal spaces, on the right side of the sternum is where we're going to place the first electrode. So we're going to go back over here and we're going to locate that site. Okay, so we fill up here for the clavicle, and we're now going to work our way 4 spaces down, and we're going to actually place this electrode with the tab facing down. Now, that's what we call V1, vector 1. And vector 1 again goes in the 4th intercostal space on the right margin of the sternum. Vector 2 is real simple. It just goes on the other side of the chest bone, also in that 4th intercostal space. So we have V1 and V2. These are 2 chest leads, V1 and V2. Going back over here to the skeleton, you can see V1, 4th intercostal space on the right margin of the sternum, V2, 4th intercostal space on the left margin of this sternum. Now, we're going to move past V3 and go to V4. We'll come back to V3. V4 actually is midclavicular on the left side, the midclavicle down in the 5th intercostal space. Okay, so we're going to go down from V2. We're going to go down 1 intercostal space, go over to the middle of the clavicle, and that intersecting point right there, 5th intercostal space, midclavicular line, is where we're going to place V4. So going back over here, we look for the clavicle, 5th intercostal space, and we're going to intersect these 2 points right there. That's your V4. And what's nice about V3 is it just simply goes right between 2 and 4. Make sure the electrodes don't overlap each other. Okay? Okay, so now we have V1, V2, V3, V4. Remember, V4 is 5th intercostal space, midclavicular. V5 is real simple. V5 goes across from V4 at the beginning of the armpit line. So you're just going to go this way all the way to the armpit line. Okay, it's sort of an intersecting point. So we're going to take and go right across from V4, right at the beginning of the armpit line. That's where that goes. And then we're going to put V6 right across from 4 and 5, right at the middle of the armpit line. Now these are a little bit cold, and so they tend to, you know, especially for elderly patients, that tends to be really difficult for them. Okay? Now we're going to take this, we're going to take the patient cable. Now, what I want to say about the patient cable is that there are a lot of wires. They tend to get tangled up, and I like to untangle them as much as I can before I get started, so that I don't make the mistake of putting the wrong wire on the wrong electrode. They're all sort of lined up to be placed on the patient. So I'm going to take my right leg, which is abbreviated RL, and right arm, which is abbreviated RA. I'm going to take those 2 wires and I'm going to place them over on the patient's right leg, The RA is for the right arm. I'm going to place that over by the right arm, just so that I isolate that lead wire from the left side. I have an L for left leg, LA for left arm, and then I have all of my chest leads, V1 through V6. I'm going to place those on the patient's leg, and I'm going to direct the wires toward the chest, and we'll put those on in just a minute. Now you'll notice that there's a clip on this cable line. That clip is designed to be clipped onto the patient's clothing so that the wire doesn't pull off of the patient. Okay, so I'd like to see you do that. Okay, I'm going to start off with the left side. I'm going to take this left lead wire that says left leg, pull it down, and I'm going to actually place that. I'm going to clip it on the electrode. Okay, try to make sure, or try to not overlap your lead wires or have your lead wires looped. Okay, then we're going to take the right leg and we're going to place that over on the right leg. And then we're going to take the left arm and we're going to place that on the left arm. Make sure that these clips are facing the right direction. In other words, don't have them upside down, have them right side up. If you have them upside down, you're going to have a difficult time getting a tracing. And you know, I try to do this in a methodical way so that I'm not confused by which lead wire goes where. I just have them already almost in position just by the way I place them on the body. Okay, now we're going to put these chest lead wires on. I like to go way back over here, find my V1, isolate it from the rest, and then bring it up and clip it to the patient's.
Sticker.
Okay, now I'm going to take my V2 and also clip that on there, making sure I get the right lead wire to the right